So tonight we are going to talk about move your body, move your brain. How does your movements, the body movements, have connection with how your brain works? So when we talk about movements, we talk about all kinds of movements, fast movements, slow movements, or the body movements. It can be as fast as running or as slow as stretching the body. It can also be moving your jaws by chewing, moving your eyes. And all these movements will stimulate the brain in one way or another. And how you move is very important because it helps to stimulate the brain in different way, or if moved incorrectly, may put strain on the body. So we're just going through a couple of things tonight. This is what we're going to talk about, movements and how does it relate to your brain health. And there are for some of us who may have restriction in movement of the neck, of the back, or different part of the body, and what could be the sources of those restrictions. And we're also going to touch very quickly on what kind of movements that are efficient and would help to stimulate the brain and the body in different ways. And then we are going to spend a little bit more on the passive as well as the active movements that you can use for your body. Now, why movements are important? Obviously, when we move, we start to breathe faster. When we breathe faster, we start to inhale the oxygen into our body, and therefore the heart starts to pump quicker. When the heart pumps quicker, you can then, the blood is circulate to all parts of the body, and especially the brain. And when the brain gets the oxygenated blood, it starts to be nourished, and therefore it encourages production of new brain cells in your brain. And this boosts the neuron ability to communicate with other neurons. Now, when it comes to blood circulation all around the brain, and it really depends on how complex is your movement. Now, on the left hand side of your screen is picture A. If you're just going to use your finger to push the lever down, that is a very simple movement. And therefore, it does stimulate the brain in some way, but it only brings a small amount of blood into the brain because it doesn't require too much thinking or too much effort just to push the lever down. Picture B in the middle, if you start to use your finger to swipe across the screen in different directions, it starts to stimulate the brain a little bit more. And of course, in picture C on your right-hand side, if you start to use your finger to move across the maze, and it is a really complex movement that requires you to do a lot of thinking. And therefore, more blood is circulating around the brain. And therefore, you can see a fair bit of red circulation of the blood around the body, around the brain. And this is what we want to stimulate the brain through complex movements. Now, movement is in your body in different directions, different way, also help to improve on your cognition and your memory. Now, look at this healthy brain on your left-hand side, beautiful cortex, the motor cortex of the brain. And when we have a lot of body movements, we tend to create more space, increase the cortical mass in your brain. But if you move less, the lack of movement actually decreases the cortical mass in your brain, and therefore leading to a lot of brain disease such as Alzheimer's disorder. And you can see how much this brain, the same brain, but shrink, the mass of this brain has reduced tremendously. And this is what we want to avoid. Now, movements also help to elevate our mood. When we move, the body produces neurotransmitter called norepinephrine as well as dopamine. And this neurotransmitter helps to increase the energy throughout the body, and it also helps to calm the brain and the body, and therefore reduce the likelihood of depression. If you look at the flash MRI scan on the right side, right top corner of the screen, if there are a lot of movements, this MRI scan basically capture the blood circulation around the brain. When there are movement, you can see the blood circulation on the left side of the picture. With the person with no depression, you can see the brain is beautifully vascularized as compared to someone who have depression, and you can see a lot of dull black area in the brain. And movements also help us to manage our stress, because when we move, there's a quick surge of adrenaline that helps us to improve the ability to think and resolve conflicts with others, help us to socialize better, help us to manage our stress better. And of course, it helps in the daily functions, how we function in the day. Now, this is a study conducted in the US by a researcher on students who have a 20-minute break, be it walking, running, as compared to those students who will sit at their desk in the classroom for a long period of time. Now, what this study found out is that when those children who have a micro break, they tend to be able to behave better, function better, learn more effectively, and socialize better. As you can see on the right side of this brain, for a student who have a lot of physical activities during in the break before they go back to the classroom to learn, these students actually has the highest amount of neuroelectrical activity in the brain as compared to those students who sit quietly in the classroom. And therefore, for a subject that you may teach a student that may require 2 hours for them to understand, you may be able to help them to increase their learning ability by just getting them to do some physical activities before going back into the study space and teach them some new concepts. Now, seems like a pretty complex slide with a complex picture, but all this slide say is about for those people who have brain injury, be it from motor vehicle accident, have a whiplash, or any injury, or any kind of trauma to the brain. On this picture on the top, you can see there are the areas of the brain called motor cortex, and it's responsible for different part of the fine motor skills. In this case, are the fingers, the wrist, the forearm. Now, when there is a brain trauma or injury, you can see the orange circle. This area of the motor cortex has a lesion, and that lesion, if we do not do rehabilitation or exercises to help the brain to overcome the lesion or treatment, then after 3 months, this lesion will actually decrease the area of the motor cortex of the hand. If there is a finger problem and it's painful, the body will start to recruit the shoulder and the elbow. And therefore, the surface area, the blue surface area in this picture of the elbow and the shoulder, it becomes bigger because we use a lot of shoulder and elbow to compensate with the pain on the fingers. If we have rehab or rehabilitation, brain rehabilitation to help the fingers to move better. On the right side of the picture, after 3 months with rehabilitation and treatment, the area regulating the hand, which is indicated in pink color, the area, it actually retains its size, if not bigger. after rehabilitation. So that shows that brain rehabilitation or exercise helps to prevent the loss of movement to certain part of the body, in this case, the fingers. And it also helps to prevent the decrease of the cortical representation in your brain. Now, why we can't move effectively? Why when we do some exercises, we start to feel there's strain in different part of the body? What could have restrict our movement? In what could have been restrictions to our movement? Now, a lot of cases, the key thing, the number one consideration is always the primitive reflex or postural reflex of the individual, in which Dr. Reza somewhat has covered this topic 2 weeks ago or 3 weeks ago. But just to simplify concept, when we were born, when every baby is born, they retain some primitive reflexes. And this primitive reflex should start to go away at the age of 1 to 1.5 years old. And this primitive reflexes will be replaced by something that we call a postural reflex. Now, this postural reflex start to develop as the baby moves. It keeps the body in an upright position or in an aligned, the spinal alignment. And the baby starts to learn how does the baby start to move in the space with the gravity. And therefore, by the age of 3.5 years old, the baby should have the primitive reflex to be diminished, and at the same time, the postural reflex should be fully developed. But there may be times that babies may not have their postural reflex fully developed. And therefore, we can see some people, they round their shoulders, they come in a slouch posture. It's not that they are too lazy to come up to have an upright posture. It could be postural reflex for the person may have not been fully developed. Look at the picture of this young boy. This boy is able to step or hop and move his body to keep the body upright on the seesaw. And he will shift his weight to keep the center of gravity over the base that he stands on. And then he actually widens his gait by lowering the center of gravity to keep his posture steady. This is a beautiful postural reflex example. And this is what we want in everybody. Even if we have good postural reflex, but over time, if our body has physical trauma, such as a whiplash from a motor vehicle accident, the brain could have been affected from the whiplash. And therefore, we may not be able to move our neck or our lower back as good as before. Emotional trauma, an example is post-traumatic stress disorder. Such disorder happens for those people who experience or witness some terrifying event that they could not forget. And that triggers will bring back memories of the trauma, and they start to have those intense emotional and physical reactions towards the triggers. And with those emotional stresses in the body, it may prevent the body movements, the body to move effectively. Chemical trauma is another example. If we have long-term effects of chemical exposure such as tobacco use, such as inhaling hazardous fumes, or use personal care products that has harmful ingredients for a long period of time, that chemical trauma may go into the brain and affect the brain function, and therefore restrict our movement in different ways. Needless to say, sometimes it's a lifestyle choice for people who do not like to move a lot, And that actually, if you do not use your brain, if you do not use your body, you will lose it. And therefore, the next few slides, we are going to talk about what I can do as a chiropractor to help you, to educate you, to give you information to move better. Number one is passive movement. Before we go to passive movements, there are just two more slides that I want to talk about effective movements. Now this picture of the man opening up the arms and extending the neck, it may seem as a very simple posture. But in order to maintain that posture with ease and with smooth breathing, it's actually not easy. In a way that, look at his hips, how his left hip comes forward, how his feet are grounded with the back foot turning 45 degrees from the midline. And how does he extend the neck without straining the neck and then still be able to breathe? That is actually a movement, an effective movement that requires a lot of conscious or mindful breathing and attention to the details of the posture. And how long he can persevere in this posture, the endurance, the resilience, and the speed of his breathing, and how much repetition he can do in the posture. All this requires effective movements. And sometimes you need help to have someone to really guide you how to move effectively. Now, I'm not asking everyone to get out from your chair and start to do this movement that I can possibly not do it at all. But this is all about good and effective movement. It's all about control. It's all about balance. How does she balance with her shoulder and the elbows? And how she have palms on the ground with her head extending slightly and the knees are directly on top of her head. All this requires skill and a lot of, this is a very complex movement that requires a lot of practice and skill, and also very controlled movements, recruiting the right muscles and also relaxing other side of the muscles. And how you can use your biomechanical advantage to move effectively. And this is where I, as a chiropractor and a yoga instructor or a health educator, to come in to help you to move effectively. Now, passive movements, the next few slides, we are going to talk about how I can help you to move effectively, either online consultation or in the clinic. So there are a few techniques that I use, the neuro-organization technique, the SOT, the ART, and also passive movements. These are the more common techniques that I use with patients. Neuro-organization technique, N.O.T, Dr. Samwat and myself work on every patient with N.O.T. N.O.T is a powerful technique that helps to integrate our nervous systems and our musculoskeletal systems to teach the vestibular system, meaning the inner ear, the balance, and also the control of the body, the posture of the body, to really teach the brain how about the exact position of the body, how you can move correctly with proper execution of each movement that we described earlier. And therefore, before you start to move, you need to have your nervous systems and your vestibular system being checked by us, by chiropractors, or anyone who use the N.O.T technique. So with the N.O.T technique is powerful because it helps to enhance our postural reflex. It helps us to be able to maintain our balance and our posture, and therefore minimize the injury of the body, prevent fall. It helps to maximize our the sports performance, accelerate recovery of the body, as well as enhance focus and learning. I also use the sacro-occipital techniques, or SOT in short. As a chiropractor, I always look at how, on the left-hand side, how the head and the shoulders and the pelvis are level. When I teach yoga, I always talk about your shoulders and your pelvis should be level in whatever that you do. Sometimes it's not that the student doesn't want to keep the shoulders level. It's because structurally, there are some restriction on the shoulders that prevent the body to have the level shoulders or pelvis. And there are three categories. It can be one side of the shoulder is higher or one side of the pelvis is higher. It could be pain around the lower back or sacrum that could have prevented the person to have a neutral pelvic movement. Or sometimes it's on the nerve impingement in category 3. I also use active release technique to combine tension on the muscle and then get the patient to do the movement to treat any soft tissues problems or tightness. Now on the left-hand side of the picture, it helps to explain the muscles on the left-hand side looks pretty good. Once it's injured, you can see a lot of disruption of the soft tissues and as well as the blood vessels, and therefore you get bruises if the muscles are injured. Poor healing. The body can self-heal. And my job as a chiropractor is to help the body to heal by itself. But there's only so much so that the body can self-heal without intervention, such as the techniques that I mentioned earlier. And therefore, my job as a chiropractor is really to help your body to promote self-healing by applying the correct posture, using the N.O.T technique or the S.O.T technique to help the soft tissue or the nervous systems as well as the skeletal systems to heal. When the body is free from any interventions or any injury, the body can then start to heal by itself with the good nutrients that you feed into the body. Now, if the body heals and you do not, if you do not receive any treatment, the body can still heal, but only to a certain extent. And therefore, you can see picture 3 is poor healing. After it has healed, then there are scar tissues built on the muscles. And this is when we need treatment to start to promote healing for the body. Okay, we need to break all the scar tissues so that the muscles can heal better, and then the movements of the joints, the bone does not move by itself. The bones are moved by the muscles, and the muscles free of injury and scar tissues can help the joints to move better. If there are a lot of scar tissues on the shoulders, this is when the frozen shoulder come in, cannot move too well. And therefore, I usually use the ART technique to help patients. Passive stretching, you can stretch actively, meaning doing the stretch by yourself. And sometimes the stretch can be more effective if someone who knows how to help you to stretch, to just apply a little bit more pressure to help you to stretch better, such as elongating the spine by just applying little pressure, or just doing a lift of your fingers or your arms to help you to feel the stretch more effectively. And therefore, passive stretching is something that I do for patients and students. Now, these are the things that I provide for my patients or students as a passive sort of movement, and you just relax and let me do the work. Now, there are things that you can do as an individual to stimulate your brain with active movements. And these are the list of things that I do for students or patients to help you to improve on your body movement and brain stimulation. For example, brain gym, we'll talk about each one of this later. Brain gym, motor imagery, motor reference learning, yoga, Pilates, dynamic neuromuscular stabilization, and primal movements. Brain gym, a lot of you may have heard about brain gym. There are just very simple movements that integrate with your brain and the sensory and the motor skills in your body, such as moving, such as stimulating the brain using different movements, stretching, and then doing a lot of drawings with the fingers. All these are part of the brain gym exercise, which helps to increase concentration, memory, thinking, reading, writing, expressing yourself, and also the mind-body balance. These are not only good. Brain gym is not only for children, but also for adults. It really helps to prepare you for the physical skills that are needed to live and learn more effectively. Motor imagery. Imagining the movements before you perform the movement. For example, if you want to learn skiing, if you just sit there and imagine what is the movement of the skiing? How does your body move? Where do your arms go? If you just have a picture in your body on the movement. My children learn piano, and we always teach children who learn piano to mime. Move your fingers, look at the notes, move your fingers, imagine the play before you really play. And that is really powerful, because once they use once they imagine the movements, it starts to activate the primary motor cortex in the brain, and it helps to assimilate. The brain starts to assimilate the actual performance of the movement and bring connections to the brain and the postures and the different part of the motor systems in the body. It makes the brain easier to plan, to control the movement and carry out the movements. So this is another strategy I teach students how to do the motor imagery. Motor reference learning. Now, to perform every movement accurately, for example, in this picture is running. On the left-hand side of the picture, that is a very familiar running form. If you were to run with your spine upright, you may experience some pain on your knees and your heels and the spine. But a good running form is leaning forward, how to protect your neck, how to protect your knees, and when you should toe off, when you should have the heels striking the ground. All this motor reference learning. It actually teaches which muscles needs to be activated and which muscles needs to be relaxed in order to carry the running effectively. And this is something that I teach. Yoga. Yoga to a lot of people may mean stretching, but it's actually more than that. Look at this guy, this man with the posture. You can see the left shoulder is higher. There's a waist crease on the right-hand side. The hip on the right side comes up and the hip on the left actually drops. Now with this head, you can see the head lean towards the right and the hip as well. How does the leg position itself? All this can be corrected with the treatment that we provide for patients through the N.O.T technique, the S.O.T technique. And at the same time, after the body has been treated, it then relies on how you as an individual maintain the posture. And therefore, this is when the rehabilitation come in. And yoga is a great rehabilitation, because when I teach, I always say the head and the pelvis should be at the center of the body, at the midline of the body before you do any movement. And you need to keep the body balanced and stable. So these are a couple of the yoga posture. You can see the limbs are in the upright position. Even when you are upside down or lying horizontally, as in the middle picture, you still have the body in absolute neutral position without straining, only if you can maintain the head and the pelvis posture. And of course, on the left-hand side, for a lot of you may be familiar with, this is an awkward posture in which you have to have your thighs parallel to the floor and the arms, thighs parallel to the floor. And it actually requires a lot of practice and skills to do the posture correctly. Ultimately, it's not about how does the posture look like, it's how you execute the posture, listen to your body and execute the posture according to your body needs. Pilates, I teach Pilates, but a lot of teachers teach Pilates for the objective of burning fat from the body. Pilates is really good if you can execute the posture in repetitions correctly. And the key thing about Pilates is we want to be able to isolate the joint and not to hyperextend the knee in this picture. If you hyperextend the knee will be painful. You will have problems at the knee joints at some stage of your life. And therefore, Pilates is really good to train the mind and the muscles and especially the joint to have the joints stabilized. If you want to work on your abdominal muscles on the right side of the picture, you need to first have your sit bones on the ground. You need to have your arms level to the floor. And then you need to recruit the leg muscles to bring the leg high without straining the neck. And this requires a lot of guidance, a lot of mindful practice, and a lot of repetitions in the practice. On the picture on the left, it may seem like an easy posture, but be able to have the pelvis level and still be able to maintain a neutral spine position and have your neck in an upright position so that you can clear your airway to breathe. That requires a lot of guidance and skills and also teaching to help you to move more effectively in every single posture that will benefit your body. DNS, in short, it stands for Dynamic Neuromuscular Stabilization. I learned this technique from a professor in Czech Republic for 3 years. And this is a really powerful technique. It's a rehabilitation series of exercises that I teach in my classes to really learn to maintain the central control and stability in the movement using the primal development positions of the baby. So we imagine ourselves from 3-year-old baby starting to turn over and starting to come to a crawling position and a standing position. How does the baby able to execute all this posture so effectively is through the core stabilization. And I teach about core stabilization in the DNS classes that I teach. Primal movements. Look at this picture. It's not an easy posture. Primal movements are the foundations or of more advanced movement like good walking, running, and climbing. It helps the body to relearn how to isolate the joints, how to put the body in a neutral position without straining any part of the muscles, but recruiting the correct muscles in each of the posture. And as you move like a lizard or a frog or a bear in this primal movement, you will start to improve your strength, the muscle strength, the mobility of the joints, the body posture, stability of the joints, endurance of your muscles, balance of the body, as well as coordination of your arms and your legs and your head. Now, my goal is to help you to put in the work to master the fundamentals of good movements in your body, to have control, mindful, and balanced movement. Not necessarily mean that, I want you to do this posture that I can't even do it myself, but I just want to share with you, control, mindful, and balanced movements are really important to help you to maintain stimulate the brain more effectively and also gain a healthy life. So now we are open to questions and answers. If anyone has any questions.
So anyone feel free to just ask away, or if you prefer to put it in the chat, you can read them out and discuss.
Hi, Alecia.
Hello.
Thank you for a wonderful presentation. It was really, really fascinating. And I'm curious if there are people who haven't been without movement restrictions per se, or bad injuries, but haven't been moving much and the muscle tone is not ideal, what would be maybe what would you recommend would be the best way to start and get into movement? Would that be yoga? Would it be Pilates? Would it be check training? What, from your experience, what do you think would be the best way to start engaging with movement?
Yeah, thank you for your questions, Michaela. For people with movement restrictions, the best way to approach the restrictions is to have your body checked by either Dr. Samwat or myself to really see what could have restrict the movements. Could it be physical or emotional trauma that we discussed earlier, or any chemical toxicity that, Michaela, yourself, you can help? You have seen a lot of clients and do some scan to check the food sensitivity as well as any minerals or chemical toxicity in the body. We want to find out what could have restricted the movements. Then, with a lot of testing and through treatments, after we've treated the patients, have a good strategy to help people to help them to move better, be it sometimes it's just the muscles problem, sometimes it's the brain trauma that we need to work on the brain using the N.O.T technique. Sometimes it could be some emotional stress. There are a lot of emotional stresses in the body that prevent the person to move forward as a person. So we need to find out what are the causes, and then we'll come up with strategies on the treatment plan as well as the rehabilitation plan. It could be brain gym to exercise the brain. It could be yoga to start to stretch certain muscles that has been so tight. It could be Pilates to strengthen the muscles.
Thank you. Now I feel like we need an extra space to be able to provide all of that for our clients.
Indeed.
Yeah.
That would be good.
Thank you, Alecia.
Thank you.
Winston has posted a question. So there's a couple of questions in the chat. So forgive me, guys, if I read it wrong or misinterpret, but it says, after scar tissue develops, it cannot be removed and will remain with us for decades. That's how I understood the question. So he's referring to scar tissue.
Mm-hmm. Thanks, Winston. Scar tissues, it depends on, I always describe scar tissues like spider webs. There are a lot of people with shoulder problems and they can only move the arm to a certain extent and they have to stop because there are too much spider webs or scar tissues building around the shoulder joints. So we can use different techniques. In the clinic, we have a shockwave machine which helps. We put a machine on, and the shock wave helps to break the scar tissues on those joints, and it depends on the depth that the machine is able to penetrate through the different layers of scar tissues and start to break them. Once the scar tissues are broken, like the spider webs, you start to clean the spider web around the shoulder joint. Oh, then the shoulder joint, the muscles start to be able to activate. And this is when the rehabilitation on the shoulder comes in to help with the movement help with the activation of different muscles around the shoulder. And therefore, once those muscles start to be activated and strengthened, then the person will have mobility of the shoulder joint. So I'm just using the shoulder as an example, but yes, scar tissues does not have to be stay in the body for decades. And you really need to address the scar tissues by having someone to help you to break the scar tissues. Yes, a lot of times we may find that, okay, I just keep moving to see if I can break the scar tissues. Yes, you may, but it really depends on how in-depth is the scar tissues and how long it has been there. And therefore, some effective treatments such as the shockwave therapy that we have in the clinic, or some active release technique that I use on patients. I understand you're in Singapore, so I can refer you to some of my colleagues who may be able to help you in Singapore with the releasing of the scar tissues or the tensions in the muscles.
Beautiful. And then we also have another question from Joanne. What sort of movements, exercises would you recommend for early dementia or early Alzheimer's?
Okay, good question, Joanne. For early Alzheimer's, we usually will get patients to come in to see us and to work on their body using the neuro-organization technique to help the brain to be able to integrate with the body and to have the body to, and also we need to keep stimulating the part of the brain that has been injured or damaged. So if it's a left brain injury or left brain problem, we work on the right side of the body. The limbs, the upper and the lower limbs, we keep activating the right side of the body to stimulate the left brain. So we really have to see how does the, what is the cause of the problem. But it's never too late to be intervened. The earlier you start, the better it is. And after the treatment, we usually have patients to come in to see me for brain rehabilitation. And I will get patients to do some eye tracking, eye movement exercises that helps to stimulate different part of the brain as well, with the right and the left brain integration, stimulate the right and the left brain integration, and also to start to bounce ball and do different type of exercises, as well as the brain gym that I described earlier, to really help the brain to stimulate the brain and to help with the neurons integrations and or communications. So, you know, if you know of someone who need that help, you know, let me know and we can talk further. We can do online consultation, and then I can refer the person to a practitioner in your area.
Oh, there we go. Sorry. Thanks for that. We have another question from Cecilia. She says, "Dear Alecia, thank you for sharing. What would you recommend for frozen shoulder? Which technique is good to practice instead of going for an operation?"
Thanks, Cecilia, for the question. Frozen shoulders are a lot of, it can, so we need to look at the reasons of the frozen shoulders. And usually shoulders problem can be related to neck movements, restriction on the neck movement, or any trauma around the shoulder joint. So frozen shoulders is pretty annoying in the sense that, you know, if you want to lift the arm up only at certain level, you start to feel the pain. And therefore, again, we need to look at where does the problem come from. Usually around the shoulder joints are the scar tissues that might have built up a lot, as I mentioned earlier, and therefore using certain techniques such as the shockwave therapy as well as the active release technique to break the scar tissues would be something to would be an ideal strategy to go to, and then to start to, once the scar tissues are broken, then we start to strengthen. Activate the muscles around the shoulder joints, such as starting to do some strengthening of the shoulder muscles, and then we will then do some stretches around the shoulders. So it really depends on the extent of the frozen shoulders. It's a very common problem, but it can be worked on for sure. You just need the right strategy, find the right strategy to help you. So again, I know you're in Singapore. If you need any help, happy to talk to the person who need that help over online consultation, and then I can refer the person for any exercises or rehab with some practitioners in Singapore.
So just a comment from Joanne. She says, thank you for the advice. We'll connect with you for local treatment recommendations. Yeah.
Thank you.
Just a question for anyone in the chat. Do you already have a means of connecting, or would we need to maybe I put the clinic number down, you can give the clinic a call, we can direct you over to Dr. Alecia. Just let me know in the comments if there's anything you need from us before the end of the talk.
Mm-hmm.
I have a question. For someone who has been recommended orthotics because of a previous injury, whenever exercise is done, pain, like a lot of what you're talking about in terms of having the correct movement to, not cause further damage and to build the right posture, could work be done in relation to the correct movement and posture to avoid having to spend money or rely on the use of orthotics to correct stance or other postures in that sense? Is that something that's possible in terms of rehab and therapy?
Yeah, orthotics. I would usually look at the biomechanics of the feet. How does the hip, knee, and the ankle align when the person walk, drive, run, or sit? All this movement, if the knees are inward, feet are outward, all this can put some strain on the ankle at certain point. And that especially I have a lot of patients with the incorrect posture of the knee and the ankle and the hip when they are driving. The foot positioning is wrong. And therefore, I have strategies to help those patients to identify what could have caused the problems of the feet pain or the knee pain. From there, we come up with strategies to tackle the problem. For foot orthotics, yes, if there is a leg length problem, if it's congenital or it cannot be corrected with conservative treatment, then yes, orthotics would be something that the person may need to have a good support, a foundational support on the feet, either be it with adequate arch on the feet, so that the body, the feet can be grounded evenly on both sides, on the right and the left foot. And also that would help with the foundation is correct. It will self-correct the hip, pelvis up and down, and the shoulder problems. So yeah, it really depends on the biomechanical problems of the person's hip, knee, and ankles, or sometimes even the pelvis and the shoulders. Once we identify it's something that needs to be corrected with a foot orthotics, yeah, then it's highly recommended to see a podiatrist to have the insole on the shoes to help the person to have a better grounding with the shoes, with the insole of the shoe in the shoes.
Thank you. So Sana has posted a question. She says, "Dear Alecia, what therapy would be best for sciatic nerve pain or injury?" I think I pronounced that right. Yeah.
Yes, thanks for the question, Sana. Sciatic pain is usually it can again, before we recommend any therapy, we find out the problems. And therefore, when we see patients, we will first ask a lot of questions to find out what could have been causing the problems. So that after we have done the treatments, we will educate the patient how to sit correctly, or how, what they can do to prevent the sciatic problem. Now, sciatica or sciatic nerve pain or nerve impingement, it can be from prolonged sitting. It can be from sitting on the soft cushion for too long. It can be pelvis, hip problem, or knee problem, or incorrect standing posture. So to identify the cause of the problem is important. And then with the therapy, we usually use the N.O.T technique, in which we have protocols to rectify the pelvic deficiency and then correct the leg length. When we apply N.O.T technique on patients, the first thing we always do is to look at the leg length. Because if your right foot is shorter than the left, the whole chain, the kinetic chain of the body, will start to compensate each other. The shoulder on the left side may be lower and the right side may be higher because of the right short leg. And therefore, it may start to pull certain muscles on the right side of the body, as well as the hip, and the nerve on the right side will start to impinge or compress. And therefore, the therapy is helpful to, N.O.T technique is a helpful technique to help to rectify any postural problems by allowing the brain and the musculoskeletal systems integration. And then with the treatment, which is on the passive side of the movement, we then move on to the active movement, which is to get you to actively strengthen the glute muscles. Usually when you have weak glute and very tight quadriceps muscles and weak abdominal muscles, you need to strengthen those muscles that are weak, so that the glute and the abdominal muscles can brace the core. You have really good core stabilization to hold the pelvis in its position, especially after chiropractic treatment. And then you can start to move the pelvis in a more effective way without having muscles to impinge, and you can stand more upright, and you can have your pelvis level when you are in the seated position. So again, number one is really to check where's the problem. Number two, to have the problem be treated passively. Number three, to have the problem to be rectified actively by having you to do the correct movements, so that the treatment can last longer, so that the problem doesn't recur, and you're on the right path to have pain-free hips.